nights. Um, Particularly over the last 30 years, we can see that warm nights are becoming more prevalent across the state. And this means a lot of significant things when it comes to public health. And in particular, it means that we are, as a population, experiencing longer heat stress. It's because our bodies are unable to cool down overnight. We have a cumulative effect of picking up heat during the day, and that heat is not able to, we can't cope with the impacts of the heat because we're not cooling down overnight. And also it's impacting our overnight sleep as well. And
So
all of these.
I'm just gonna,
So yes, as I was explaining, we are experiencing hotter days and warmer nights, and this is having an increasing impact on our own health. We are unable to get rid of that hot temperature, um, and like I said, it's increasing to longer heat stress. And I think we wanted to ask this of our webinar community today is like, have you or someone else you know have ever experienced heat stress? So I think David's going to pop that poll up on there, and we're just really interested to see how many of you feel like you've experienced heat stress, particularly over the last couple of years living here in California or wherever else that you live in. So whilst that poll's running, I'm just going to keep going with the presentation because we've got time to get through today. So as I said, extreme heat and longer periods of heat stress are having a real significant impact on public health across the state. And we particularly see this in heat-related illnesses, which we can track through emergency department visits and admissions. And what we see in our own data here at Tracking California is that we see that this prevalence of heat-related illnesses are increasing, particularly since 2005. And it's not just in places where you expect, for example, in Southern California, but you can see from the map that it's happening actually across the state. Specific areas inland are having higher rates of heat-related illness, emergency department visits because of these extreme temperatures. And what's very, very interesting in our data is that when we look at extreme heat events, or what we might more familiarly call heat waves, we can see these spikes in the data. So I just wanted to point out two events that are within the last couple of 20, 25 years, which is the 2006 heat wave and the 2017 heat waves that occurred in California. And just borrowing some data from UC San Diego, these are what the heat waves looked like in terms of temperatures across satellite imagery. And that in 2006, we see that there was a real extreme heat wave that produced that spike in our heat-related illness impact that we see in our data set. But also in 2017, we had some very similar heat waves that happened, but they impacted the state in different places in different ways. So in June 2017, we had a real significant impact of heat on inland communities, for example, in Imperial County down in Southern California. But a few months later, in August and September 2017, we had a very different type of heat wave, which has actually impacted coastal areas, including San Francisco County, of all places, hitting some of its most extreme temperatures that it's seen in the last 100 years. So heat waves are happening across the state, and they are impacting different communities and having this real public health impact as well. And right now we're just showing our public health, the heat-related illness version, but in addition to heat-related illness, heat and heat stress can very much exacerbate cardiovascular and respiratory chronic and acute conditions that we could potentially study in the data that we have. If you are interested in more heat-related illness data specifically for your county, and so you can track these trends as well, you can have a look at that in our Data Explorer on our website. Beyond our heat-related illness data set, the area of data and tools for California for extreme heat is growing. It's something that we've seen as a program, that we are seeing more data out there and more tools available to yourselves, your communities, to understand what is happening in the for extreme heat in California. What we've seen is that there's sort of three core focuses. We're looking at the prevalence of heat, the vulnerability to heat, and also the impacts of heat, for example, our heat-related illness data set. So when we're looking at the prevalence, we're looking at the frequency of extreme heat events, their duration, geographic scope, extremity, and also how these patterns have changed over time, and in particular projected to change in the future. There's also many vulnerability tools out there that are looking at the propensity or the predisposition of basically people, our environments, our homes, to be adversely affected by extreme heat. And when we're talking about vulnerability, we're looking at different components of vulnerability, including the exposure, the sensitivity, and sort of the potential impacts and the adaptive capacity or resilience that a community might show towards vulnerability to extreme heat. And then finally, there are obviously people out there like ourselves who are trying to track the impacts of extreme heat and these heat waves on population health by looking at heat-related illnesses. We've been keeping an eye on what these tools are, and we're just really interested to see what people have been using out there. So we're just following up in this presentation with an extra poll to see, have you used any of these data and tools that are out there at the moment in the California sphere for tracking heat, doing heat assessments, or looking at vulnerability to heat? So if you're unaware, there's a few tools coming out from the state and from other nonprofit organizations, including California Heat Assessment Tool, Cal Heat Score, which was recently released by OEHA, I believe, and then the Cal Adapt Climate Tools and Data, the California Healthy Places Extreme Heat Edition. Additionally, at a national level, there's the Census Bureau Community Resilience Estimates for Heat, the CDC Heat and Health Tracker. And then specifically looking at vulnerability to heat, we have CDPH's Climate Change Vulnerability, and then a new platform that's coming soon called the Vulnerable Communities Platform from another organization. So as I said, it's a very busy sphere of extreme heat in terms of data and tools that are out there for you to use. And we're just really interested to know what people are using and what they find useful and what they might not find useful at the same time. And to that point, we just wanted to talk to you about how we are using extreme heat and looking into extreme heat within our organization at Tracking California. As the rest of the webinar is going to do, it's going to highlight how we're working with extreme heat data and tools, and including some new data and tools that we have produced. So we just want to let you know is that if you need help, we're out there to help translate technical data sets and dashboards into useful community-focused tools, and also to help conduct community outreach to understand if tools and data are useful. We're also here to help communities to help identify and extract the data they need through technical assistance. If you see these tools online and want to know how to use them, we can certainly help you in that area. And also, as will be evident from the final two presentations in this webinar, is looking at how we can design and carry out analysis and research that can answer specific questions on the impact of extreme heat for specific populations or outcomes. So before I'll move on from this general broad introduction into extreme heat for communities in California, and we're going to move forwards with the main content of the webinar, which we will begin with a presentation, as Isabella explained, called Tracking Community Exposure to Hot and Smoky Climate Events by our partners at UCLA, and their incredible work looking at the combination of hazards of extreme heat with smoke. And then we'll move on to some data analysis that we have conducted at Tracking on looking at the impact of the heat on a very specific vulnerable population, which is the unhoused. So I will hand over to Miriam and Rachel at UCLA.
Thank you, Joe, for that for the invitation to speak here today and to share our research. My name is Miriam Marlier. I'm an assistant professor at the UCLA Fielding School of Public Health. And today, along with my colleague, Dr. Rachel Connolly from UCLA, we will present on a publicly available tool that our team developed. The goal of this project is to understand how communities across California are exposed to climate extremes. And we have a particular focus in this project on extreme heat and air pollution from wildfire smoke. Before I begin, I would like to acknowledge our funding from NASA's Equity and Environmental Justice Program, as well as the rest of our project team here at UCLA, as well as Howard University and partners at Tracking California. Next slide, please. So I want to start with a little bit of background on this research topic. As many of us who live in California, as well as other states, have experienced firsthand, climate-related extreme events are increasing in many locations. And while we often think about our exposures to different types of climate extremes individually, such as thinking about extreme heat on its own or wildfires on their own, we are seeing now that they are often occurring at the same place and time. So this is often described as a compound event or a combined climate event, the latter of which is the terminology that we will use today. And also what makes this concerning from a public health perspective is that exposure to combined climate extremes like heat and air pollution from wildfires is potentially more harmful than exposure to either individually. And further, certain communities can be more vulnerable to exposure to combined climate extremes. Next slide, please. So with this background, I want to provide an overview of our project's overarching research questions and approach. So first, we wanted to understand how individual and combined climate events focused on extreme heat and wildfire smoke varied across the state of California over the past decade. And second, we wanted to connect on the physical climate extremes with metrics that can capture different elements of population vulnerability. So after completing this analysis, we produced an online dashboard that shows individual and combined heat and wildfire smoke events. And Tracking California worked with community partners to develop regional story maps and to help to translate the results from our scientific study. So now I'll turn it over to Dr. Connolly, who will share results about how we developed this tool, and we'll walk you through some examples of how it can be used.
Great, thank you, Dr. Marlier. So for this project, we focused on two major climate-related exposures in California, as Dr. Marlier introduced, wildfire smoke and extreme heat. And we really wanted to answer the question of how many days had extreme heat, extreme smoke-specific fine particulate matter, or PM2.5, or both of those exposures in each community or census tract in California over an 11-year period from 2008 to 2018. And so using a tool called Google Earth Engine, we overlaid daily data over that 11-year period and calculated the number of days in each census tract that exceeded thresholds for both heat and smoke, PM2.5 individually and on the same day together. And we used public data sets for this analysis. The smoke PM2.5 estimates came from the US EPA's Community Multi-Scale Air Quality Modeling System, or CMAQ, which provides 12-kilometer scale gridded data. And for smoke, we used a threshold of 15 micrograms per cubic meter for categorizing an extreme exposure day based on daily air quality guidelines from the World Health Organization. And for heat, we used grid-met meteorological data to calculate heat index, which is a combination of relative humidity and temperature. And we used a threshold that was locally varying, so different for each neighborhood, and based on exceedances of the 85th percentile of historical summer heat within a census tract. Ooh, sorry, a little bit of a lag. So now we can get into what the data showed us. So on this slide, heat exposure is shown on the left, smoke exposure in the middle, and then combined exposures where both heat and smoke thresholds were exceeded on the same day are shown on the right. And the patterns for heat and smoke follow what we might expect. So we see higher heat exposure in areas like Imperial, Riverside, parts of San Bernardino, as well as the San Joaquin Valley. And for smoke, the most affected areas are in Northern California and along the Sierra Nevada mountains on the eastern side of the state. And when we look at combined exposures of both heat and smoke on the same day, the total number of days exceeding both of those thresholds is relatively low across the 11-year period. However, the areas with the most overlap of those two exposures are concentrated in the San Joaquin Valley, with some extending into Northern California as well. And this next slide shows an example of the types of results that we are seeing when we compare our data with population vulnerability characteristics, which in this case is from the CalEnviroScreen tool. So for context, CalEnviroScreen is an environmental health screening tool for California and includes a population characteristics percentile that captures key health and socioeconomic indicators to help identify communities that may be more vulnerable to environmental stressors. And so in the table shown on this slide, we highlight the top 10 census tracts in California with the highest number of combined extreme days where both heat and wildfire smoke thresholds were surpassed on the same day. And then the right-hand column shows each tract's CalEnviroScreen population characteristics percentile. And then the image, the map on the right shows statewide vulnerability from CalEnviroScreen, just to provide a broader view of how areas compare across California. And when we look at these top 10 tracts with the most combined exposures, a few things stand out immediately. Also, all of these tracts are located in the San Joaquin Valley, which is a region that contains many of California's state-identified disadvantaged communities. And also all but one census tract are in the top quartile for population vulnerability, as shown in that right-hand column of the table. And so now we'll move on to briefly introduce the dashboard that we developed, which is currently in beta or a pre-release version. And we've tried to keep the design of the dashboard as simple and user-friendly as possible. You can toggle between tabs in the dashboard to view maps for smoke, heat, and combined exposures, which allows users to explore each type of hazard individually or together. And we also included a separate map for CalEnviroScreen population characteristics in the tool, as well as a bivariate map that shows combined hot and smoky risk on the same day alongside CalEnviroScreen vulnerability as well. And then on the right side of the dashboard, there's a pop-up panel that provides community-specific information at the tract level. And I'll walk through that briefly on the next slide before moving to a demo video of the tool. And so on this slide, I'm going to show an example of one specific neighborhood from the dashboard's community profile section. And so this census tract is actually the last one on the list from the table on the slide before last. So meaning it's one of the most highly exposed and vulnerable tracts in the state. And so here's what we're able to include for each tract in this section of the dashboard. So first you can see these heat time trends along with a comparison to the statewide average. And this helps to highlight just how much more frequent heat exposure may be in a given community compared to the rest of California. And then we also include smoke time trends, as well as the combined exposure trends showing how often both hazards occur on the same day over that 11-year period. And then we also include additional details in a table format for easy reference, which makes it simple to extract and interpret any data at the community level. And so now that I've described the dashboard a bit, I'm going to move on to a brief demo video of the tool. All right. So this is the splash screen that the website will take you to, which explains the project, the partners, and the funder, which, as Dr. Marlier stated, was NASA's Equity and Environmental Justice Program. And then when you close out of that, on the left side here, we have instructions for use of the dashboard. And this also explains each of the different maps that are available in the tool. And at the bottom of that instructions tab, there's a button to choose a specific county or multiple counties and zoom in and out. And you can scroll down to pick a county or type in the name of a county and, oh, excuse me. Looks like the video. Okay, there we go. County and click on it. And then when you unclick on that, the map will reset. And then, as I mentioned, you can click these tabs at the bottom to move between maps, and they align with the legends in this box. And then, so here we're just clicking between maps, to show the heat map first, the smoke map second, followed by combined exposures, and then CalEnViron's screen in pink, and then a combination of exposure and vulnerability in this bivariate map here. And then we also have some data resources in this box right below the legend where you can click on a link that will take you to a Google Doc for some methodology details, or scroll down for a brief overview, and also find contact information as well if you have any questions or requests. And then if you click on those 3 lines in the header, you can find some external resources on climate change and health as well. And you can also type in any address into the search bar on the map to zoom in if you want to look at a specific location. And then finally, on the right side of the dashboard is where we have that community pop-up that I had walked through before on a previous slide. So I just clicked on a census tract and we can see that information come up. And first we have this temporal trends chart where you can see heat, smoke, and combined days for each year. And you can click those arrows to tab between the different exposures. And then next we have a comparison to the statewide averages, and you can see how each community differs from the state, and hold your cursor over the chart to see specific numbers of days. And then again, you can use the arrows to tab between the charts for different exposures. And then finally, you have a table down here with some key metrics of interest for the community, and that's really it for the demo. I know that was really brief, but we wanted to give you an idea of what we're offering in this tool. And then the last thing I'll just quickly mention is that the mobile version of the dashboard is particularly limited. So we do recommend that people access this on a computer rather than a phone, just to get the full user experience. And this is a beta version, so we happily will accept comments and feedback on what we've shown here today. And with that, I'm going to pass it back to Dr. Marlier to share more about the work that our partners at Tracking California have done with the data on heat and smoke exposures.
Great. Thank you so much, Rachel. So if you can click through to the first one. So I'm going to share some of what Tracking California has worked on with community partners across the state to develop story maps. So each story map starts with an introduction to a specific region through a map tour. And this allows users to see how communities have experienced extreme heat or wildfire events. So we're seeing an example here in Lake County that recently experienced a record-breaking heat wave. Next click. There are also sections of each story map that are dedicated to extreme heat, wildfire, smoke, and combined extreme events. So in each of these sections, Tracking California has compiled quotes from community partners who we're working with in each region, as well as additional data that showcases the impact of these events locally. So in this image right now, you can see a data snapshot for the wildfire smoke section of the story map in Lake County. And next click. And then each of these sections also has a carousel that allows users to cycle through screenshots of the hot and smoky tool and take a closer look at the 3 different communities who Tracking California partnered with and see how they are likely to be impacted. So for example, you can see a summary here for the community on the west side of Clear Lake. So we're currently in the final stages of collecting and incorporating feedback, but anticipate the release of these story maps very soon. Next slide, please. So just to wrap up, as Dr. Connolly mentioned, with the overview of the data that went into our tool, we found variability across the state in terms of where and when combined climate extremes were experienced across California. Our analysis is based on publicly available data sets, and with this analysis, we developed an online dashboard that can allow users to examine results both at the state level as well as for specific communities. As Rachel mentioned, the Hot and Smoky online dashboard tool is currently a beta version, and we welcome your feedback as we're working to finalize the resource. Our email addresses are available at the end of this presentation, so we welcome you to get in touch. And with that, thank you again for the invitation to share our work today, and looking forward to the Q&A later.
Thank you both so much. And I saw there's some questions coming in the chat, so that's great, and we'll get to them at the end. And now I'll pass it back to Dr. Joe Wilkin to share on a different heat analysis.
I'm going
And
to
I'll be
leave
the
Catherine.
slide
Oh,
person.
Scarlett. Thank you.
So let's see if this works this time.
Looking good to me. Thank you, Scarlett. Okay, so I'm going to be the first of two presentations on the data analyses that I talked about in my introduction presentation that we are able to do here at Tracking California, specifically through our access to healthcare information data. I'm actually presenting work on behalf of a previous employee, Katie Clyde, who I have seen is on this call, so I'm very happy that she's here. Her work, particularly on this area of understanding health impacts on the unhoused in California over the last couple of years, for the last couple of years of data sets, has been really, really great. So I'm only presenting a very, very small amount on her work. There's a lot more there that we will hopefully be publishing in the future. So the small part I'm looking at today is tracking the impact of heat on the unhoused. Just before I get started, I wanted to just recognize that when it comes to extreme heat, vulnerability affects so many different types of populations across California, whether you're looking at specifically the geography of where people are living, whether it's border communities down in the Southern California or inland communities towards the east of the state, whether you're looking at specific demographics, pregnant women and young children, or the elderly, or people who are suffering from chronic and acute conditions that can get exacerbated by heat. Different populations have an increased vulnerability to the impacts of extreme heat, just depending on their own demographics. But one specific population that we do know extreme heat really, really has an impact is, of course, the unhoused. So next slide, please, Scarlett. And we've been very fortunate in the last couple of years to be able to start tracking this due to a data update that I'll explain in a couple of slides' time. So just to clarify on some terms here, because the distinction between a sheltered and an unsheltered unhoused person is pretty important, particularly when it comes to extreme heat. So when you're looking at unhoused or homeless, I'm going to try to refer from moving forwards to unhoused, but most of the things that you see published, for example, from the US Department of Housing and Urban Development uses the word homeless, but I will focus on trying to say unhoused. An unhoused person is a person who lacks a fixed, regular and adequate nighttime residence. Within that group, you can either be a sheltered unhoused or an unsheltered unhoused. So when you're sheltered, you can be accessing things like emergency shelter, transitional housing programs, or safe havens. So you do quite literally have a roof over your head. When it comes to unsheltered, unhoused, it's the people who primarily don't have a nighttime location like that. It's they're using something that's not designated for sleep, whether that's sleeping in the streets, sleeping in vehicles, or in parks. So very much two different types of experiences that these unhoused populations are going to have. And some people can be chronically unhoused or very much unhoused for a very specific, small amount of time. The statistics that we're using today are just looking at that broad scale unhoused status instead, rather than trying to have any further distinctions. Okay, next slide, Scarlett. So just a bit like heat, I don't think it would surprise many people living in the state that being unhoused in California is a prevalent and growing issue. The total homeless or unhoused across the state has increased in the last 5 years. This table I've put together by extracting data from the annual homeless assessment reports that the US Department of Housing and Urban Development produce. And you can see the annual increase rates that are happening. In 2021, we don't have data for total homeless and unsheltered homeless because of the COVID pandemic. It was not appropriate for that data to get collected. So you can only look at the rate for 2020 to 2021 amongst the sheltered population where there was information there. But as you can see, it's nearly 190,000 people across California are designated unhoused. And a majority of that is actually in the unsheltered category. So I just wanted to show you the statistics on the unhoused population before we get started. Next slide. So as I explained, different demographics have different levels of vulnerability to climatic extremes. The unhoused populations have an increased level of vulnerability, specifically to hot and cold temperatures, flooding, and secondary impacts such as smoke from wildfires. I think we can all understand why without a home to go to, you face immediate and severe exposure to extreme weather events. And without anywhere else to go during these events that are occurring for longer, you're going to face the most extreme and longer durations of the impacts that these events can have. And at the same time, you have limited access to resources for protection, whether that's simply trying to make sure that you have some shade structure to live on, to be under, access to hydration, etc. And also access to anything to help to rebuild post-event. If you lose any of the resources that you have already, you do not have the assets there to simply purchase more things. And this is all compounded by the extreme isolation and the stress of being transient. And that has a huge impact on people's mental and physical health. It's a lot harder to build back physically and mentally if you do not have a home to go to. So the unhoused population do have heightened health risks, which had significant implications for public health. Next slide, Scarlett. The thing about that is that until recently, and I say 2019, it was actually very difficult for us at Tracking California to literally track the impacts of things like extreme heat on the unhoused. When we've been creating our data sets that you can see on our data explorer that we call our national consistent data and measures, essentially the unhoused were not included in any of those tabulations, either at the state level or in a sub-county level, simply because we did not have a zip code for them. Being unhoused, you often won't say that you have an address, and so a zip code is often not provided when you are going into the emergency department, either as a visit or a hospitalization. So housing status was not actually routinely collected in ED admittances until 2019. In 2019, the Senate Bill 1152 actually mandated the standardization of this collection of housing status in discharge protocols. So we started to collect data on whether someone was homeless or not. It had a very specific way of creating that indicator, but using a Z as a zip code. So just a couple of Zs were put into a form. But at least it enabled us on the receiving end of these data sets to understand that this person wasn't missing from the data set. They were simply an unhoused person that we could then look to include in some of our tabulations. So by adding this indicator into the data set, we actually realized that we could start tracking health impacts for the unhoused. And as Isabella talked about at the start of her introduction presentation, we collect data on a range of conditions and illnesses. And so Katie, our colleague who is on this call, conducted a preliminary study on how this big change in the data would change our nationally consistent data measures, or ANCDMs, that we produce on our website. As I said, the unhoused population were not included. So we were trying to see, well, in 2019, for example, if we do include the unhoused in our calculations, where do we see the greatest change in our tabulations? And so Katie conducted this for 4 different conditions that we collect data on, including asthma, COPD, heart attack, and heat-related illness. Next slide, Scarlett. And during this study that she conducted, what we found was that actually for heat-related illness, we see this huge increase in the number of hospitalizations or visits, specifically for heat-related illness. So what this table is showing is that this is the number of visits that were excluded because we didn't have this information on these people who were unhoused. And this is the increased rate that if we include these homeless or unhoused population into our tabulations, this is the rate at which it increases. And as I said, for heat-related illness, we were basically missing 12.3% of our data, which is for ED visits, and 19% for hospitalizations, which is an incredible amount of data to be missing from our tabulations. Asthma, COPD, heart attack had 3 to 6%, but at heat-related illness, it had the greatest rate of exclusion. So with this finding, we're very, very interested to see who are we missing from our data, and conducted sort of an initial breakdown of the demographics for the ED visits and hospitalizations for heat-related illness. And that's what I'm just going to briefly present to you. So these are the people that essentially were missing from our data on heat-related illness for 2019. And what we can see is sort of compare across our different demographics, who within the unhoused population are greatest affected by extreme heat. And what we saw is that despite accounting only for 0.4% of the state population, actually 9% of all heat-related illness admittances were coming from the unhoused population in our data set. And when we start to compare across our demographic groups, across the status between housed populations and unhoused populations, we can start to see that there's some significant differences. And that's where I'm going to look at this graph that you can see on the right-hand side of the slide. What you can see is that the people who, the rate of admittances for the different demographic groups, and what we can see is that for the unhoused population, men, Black Californians, white Californians, and older adults, which are between 35 and 64, have an increased had increased visits to the ER emergency department for heat-related illness in comparison to their housed counterparts. I'm just going to leave that slide up there for a second. Got next slide. So to contextualize the numbers that you just saw in front of you, what we basically were able to see in this demographic breakdown is that heat-related illness disproportionately impacts California's unhoused population. As I just gave you the statistic, unhoused was 0.4% of the state's population, but 9% of heat-related illnesses, ED admittances in 2019. And when we start to break down the different demographics, we can see how this disproportion affects the demographic groups. And the three that I pointed out were for men, Black Californians, and for older adults. So for men, they constitute 65% of all heat-related illness emergency department admittances, but 73% of unhoused heat-related illness emergency department admittances are men for the unhoused. So they have a greater representation in the unhoused heat-related illness than the general housed population. And when you compare this to the general population of California, men represent approximately half of the state's population. So they are both overrepresented in both the housed and unhoused heat-related illness admittances. When we look at Black Californians, we see that across both unhoused and housed heat-related illness admittances, it's an 8% are Black. But when we look at specifically unhoused heat-related ED admittances, it increases to 12%. And more importantly is that when we look at the percentage of the state populations, Black Californians are only 6.5% of the state's total population. And so once again, we can see they're both overrepresented in both the housed and unhoused heat-related illness admittances. And then finally, with older adults, again, older adults, this group between about 35 to 64 years old, they account for about 43% of all heat-related illnesses across both unhoused and unhoused categories. But when we look specifically at the unhoused, it increases significantly up to 68% of all heat-related illness ED admittances. That group, that category across the state population is actually only 38% of state populations. So when we look at the actual heat-related illness admittances, we see that across both housed and unhoused, it's slightly overrepresented, but when we look specifically at the unhoused population, it really is substantially overrepresented in housed and in the unhoused category. So unhoused adults at between 35 and 64 years old have a high representation across HRI ED admittances than what they really should. Got it. Next slide, please. So trying to contextualize this to understand why certain demographics within the unhoused are more vulnerable to heat-related illnesses, you have to understand and have a look at the population statistics alongside. The problem is that we don't actually have a sort of a population statistic for unhoused across California. And the only thing that we could look at is sort of the national levels. So I think for what I was trying to look at during this study was that factors that are likely to include why we see the prevalence of heat-related illness across these three different demographic groups are two factors, in addition to potentially others. Firstly, that these both men and Black Californians are more likely to be unhoused than any of the other demographic groups. We can only compare this at the national level, where at the national level, men represent approximately 60% of all unhoused. Older adults over 24 years of age are 73% of our total unhoused. And at the national level, approximately 40% of unhoused people are Black. In California, this is very much an estimate. It's an estimate that 1 in 4 unhoused are Black, but that is very much a proxy estimate. We don't really have a huge amount of information on, like I said, the demographics at the state level of unhoused. But this is potentially why more people from these different demographics are visiting the ER for heat-related illness. And one big distinction to make is that I think that from looking through the data sets is that they are more likely to be unsheltered rather than sheltered. When we look at the national level, men represent nearly 69% of all unsheltered, unhoused people across the country, and adults over 24 years of age are 90% of all unsheltered, unhoused across the country. So when you're unsheltered and unhoused, you, as I said at the start of the presentation, you're facing the elements for greater extremes and a longer duration. And so in a way, it's unsurprising that their visits to the ED for heat-related illness is much greater. This has just been an initial preliminary analysis, and it can't rule out other factors such as chronic health conditions, such as asthma or diabetes, that are also likely to drive heat-related illness amongst the unhoused. That's a study that we'd love to do in the future, but this was just the initial findings that we found based on realizing who was missing from our data set as we had this data update. Next slide, please, Scarlett. So this was a very quick summary of the study of basically two studies that we completed at the same time. One looking at the impact of this SB 1152 housing status update and showing to us who was missing from our data for our NCDMs, but then also this demographic study of the heat-related illness, where we saw this greatest increase in our tabulations for once we were able to include them in our tabulations. This update was sort of a critical improvement in the inclusiveness of house surveillance, particularly for a highly vulnerable population. Being able to now include the unhoused is essential to help understand how heat-related illness and obviously the other conditions that we looked at are impacting and in response to, for example, extreme heat events. So we have future work proposed within our team to sort of track heat-related illness admittance for the unhoused over time since 2019, and obviously this potential to link to other chronic health conditions to see in the data whether we can find other factors that are likely to drive heat-related illness amongst our unhoused populations. And in addition, and the presentation that's going to follow quite swiftly now is also looking at new research linking these heat-related illness admittances to location and extreme heat events. And I think I will hand that over to them.
Okay, thank you, Jo. Hi, everyone. My name's Catherine. I am also part of Tracking California's data team. And for our last presentation, Scarlett and I are going to be talking about our Heat Up project, which we've been working on kind of as an extension of the work that Jo just presented on. And we'll be sharing some preliminary findings, which we haven't published yet, so we just kindly ask that you do not disseminate these outside of the presentation. Next slide. Okay. So just to recap what has already been shared so far, we've seen from Miriam and Rachel's presentation that climate events like extreme heat and wildfires are occurring more frequently in California, and that sometimes these events can occur together, creating circumstances where people are exposed to extreme heat and smoke at the same time. And we're learning that on these days, the health risks are often greater. We've seen from Joe's presentation that some people, such as those who are experiencing homelessness, can be more vulnerable. And we also know from a recent study by Laura Schwartz and her team that unhoused folks in San Diego experienced ED visits associated with wildfire smoke exposure and also heat waves. However, there's still little we know about the overall health effects of people who are unhoused when looking at these climate events, especially at a statewide scale. So that was one of our goals. Next slide, please. So we wanted to do a deeper dive in this area and first ask specifically, how does exposure to high heat events and wildfire specific PM 2.5 impact the risk of ED visits for heat-related illness and cardiorespiratory illness among the unhoused population in California? Next. And secondly, is the magnitude of these illnesses greater during periods of both wildfire and heat in comparison to only one of these events? And so essentially we were looking at what happens on days when the temperature is hotter than it has historically been. What happens when there is a wildfire on the same day? And is there an elevated risk for those experiencing homelessness on these days with these climate extremes? So our goal kind of was to build upon the heat illness findings among the unhoused that Joe presented on in her presentation. First was by looking at more years of data. So we expanded 2019 to 2020. Second was looking at other health outcomes such as cardiovascular and respiratory illnesses that are also known to increase during climate events. And then lastly, we wanted to link these health outcomes specifically to days with high temperatures and wildfire smoke. Next. So for the study population, we looked at all emergency department visits from 2019 to 2020 for heat-related illness and also cardiorespiratory illness to see if there were similar trends. I think Joe presented a lot on the heat-related illness trends, but we wanted to kind of take another look and look at also cardiovascular and respiratory outcomes as well. And again, focusing specifically on the unhoused population who are disproportionately impacted. And just looking at the data very briefly, we see that 3% of all emergency department visits for heat-related illness and cardiorespiratory illness were among those experiencing homelessness during this period. Next, please. Okay, so before we get into the methods of our analysis, I briefly just want to share the data that we were looking at for the years we focused on. For the climate events, we looked at heat exceedance days. This was very similar to the data that Rachel and Miriam had shared in their presentation. In this case, we looked at the number of heat exceedance days measured at the zip code level, specifically because this is what the health outcome data is also measured at, the zip code level. And as Joe mentioned, now that we have a better sense of where unhoused folks are within this health outcome data, we were able to use the zip code of the hospital that unhoused folks were admitted to as kind of an estimate of where they might have been exposed to these climate events such as high heat days. Next. And so we also looked separately at wildfire smoke days, which you can see here. There's a concentration in Northern California and also along the Sierras. Next. And then lastly, we looked at combined heat and smoke days. And you can see that we see a concentration specifically a little bit in Northern California, but then also the San Joaquin Valley. And then just looking at the distribution of heat illness across zip codes for unhoused and housed Californians. This is again at the zip code level. And I think it's important here, kind of big takeaway is to note that we do see unhoused folks experiencing heat illness across California and not just in the major metropolitan areas. That was kind of, maybe an assumption that we may have, but it's actually, folks are showing up all across California in the emergency department visit for heat-related illness. Next. And so when looking across heat illness, specifically looking at, across the months, we see an increase in emergency department visits, especially in July and August for both those who are housed and unhoused, and especially when the daily heat index is at its peak. So just kind of looking at the climate exposure data along with visits of ED visits for heat-related illness, this kind of gave us an indication that there's likely an increased risk on hotter days. And so this led us to want to do a kind of more in-depth analysis that I will hand over to Scarlett to talk more about.
Okay, thanks, Catherine. So, to answer these research questions that Catherine introduced, our main question of are unhoused individuals at greater risk during these heat or smoke events, we used a time stratified case crossover study design, which we don't need to get into a lot of detail around, but it's ideal for studying rare and acute, so point in time outcomes linked to transient exposures like smoke and heat, or exposures that can move around. And this approach was also used by Lara Schwartz's San Diego study that is a very similar analysis, but just looking at San Diego County. So it's a widely used method in environmental epidemiology in general. So what this actually does is it compares a person's exposure on the day of their ED visit to their own exposure on a control day, specifically a day, the same day of the week in other weeks of the same month. And so this helps account for individual level confounding and seasonal patterns. And this is getting into like some hardcore epi talk that I won't dive in any further. But it allows us to basically assess the odds, the increased risk of an ED visit during one of these heat or smoke events for that same person as a day when there wasn't a heat and smoke event. And so during this, we also tested 12 different exposure definitions. The UCLA team talked a little bit about this, but there isn't one set definition by temperature, for example, that we all consider this means extreme heat. And we know this also because many folks experience heat in different ways, and 80 degrees could feel very different to me than it does to someone else. And so there's a lot of these different exposure definitions, also smoke thresholds. And so we looked at a whole series of them. And then we also looked at ED visits during and up to 3 days following exposure. So we looked at some lag days as well, because we know that ED visits could happen after a smoke event explicitly happens or after a heat event too. We then also wanted to look specifically among the unhoused patients coming to EDs in those 2 years, comparing the odds with demographic trends among ED visits. We explored the odds by age, by race, ethnicity, and by sex among the unhoused population. And so the outcomes we were looking at were an ED visit for heat-related illness or a cardiorespiratory illness. So that includes all of these different cardiovascular disease and asthma, acute rheumatic fever, and a whole range of cardiorespiratory outcomes. And so the output is an odds ratio comparing the event days to the non-event days, which lets us say this community was X times higher risk on this day. And that's what I'm going to present right after this. And one last thing I'll say before I jump into it is, and we can talk about this in the Q&A, is I saw a question about, ED visits. Is this a good representation of this population? Are there other data sets that we can look at? And it's really a thing that we're thinking about actively, and there's lots of other data sets we can look at. But ED visits, emergency departments are generally this safety net for unhoused folks that during an extreme health event, they are transported to an ED, a hospital without access to other supports. And so we actually, it's not surprising that we're seeing a lot of these heat-related illness events in the ED data. And I think that it actually does make a really good representation of this population for that reason. So first, focusing on heat exceedance events. For all of the heat data I'm presenting today, we're just picking one of the definitions that we looked at. We're looking at the 95th percentile heat index And if you're not familiar with the heat index, it just combines air temperature and humidity, and it gives you what's known as the feels like temperature. So 95th percentile heat index is one of those ones that many people use as a standard. Again, there's no set standard. That's what we're presenting here. And what we found that is that during extreme heat events, unhoused individuals were 38% more likely than housed individuals to visit the ED for a heat illness. So the odds ratio you're seeing here for unhoused folks is 5.91 compared to about 4.2 for housed individuals. These are both, so the risk rose for everyone on a heat day to have a heat-related illness, but you see an even more elevated odds of unhoused folks, pointing to this greater vulnerability. So we also saw modest but notable impact of heat on cardiorespiratory illness. Unhoused folks were 11% more likely to visit the ED for these conditions during a heat event compared to housed people. Specifically, the odds ratio for unhoused was 1.13 versus 1.27 for housed. And often in studies of heat illness, we'll just say that we see this trend that the odds for heat illness are extremely inflated during heat events, but that's partially due to the fact that medical professionals are much more likely to recognize and diagnose heat illness during a heat event. And so that's an important confounder to think about, and why we see such high odds among both housing statuses for heat illness, but cardiorespiratory illness, this other thing that can be related to experiencing extreme heat for someone, but isn't necessarily more frequently diagnosed during a heat event, can be a good, for that reason, all that more important, way to distinguish or identify that we're seeing a trend. All right. So then we looked into different stratifications, ways we can break down what's happening among unhoused folks during these heat events. And so Black Californians stood out with substantially higher odds of ED visits for heat-related illness or cardiorespiratory events during heat events. The odds ratio was 11.5, so much higher than any other group. But also, I would just note that this was a small population of a small number of, 800 heat-related illness events over the whole 2-year period. That's why you see such a large confidence interval. These are small counts of folks. And then also to mention that, for example, Asian American, Native Hawaiian, Pacific Islander folks had to be combined to other because we have to suppress data at very low counts. And so we get, these limitations of small numbers of folks in terms of actually breaking down by race ethnicity. When we look at age, like Joe shared, we really do see huge disparities by age. So seniors who are unhoused, those 65 and older, were 84% more likely to experience heat-related illness than unhoused individuals who were 18 to 44. And we also saw the elevated risk in the 45 to 64 age group that had 29% higher odds of heat-related illness compared to the youngest group. So we're seeing this clear age gradient here, but it's worth noting, given that the life expectancy for unhoused folks is closer to 50 across the United States, the risk is higher even in that middle-aged group. And that was one of the reasons, I believe, why in the first analysis that Joe shared, that whole age group was combined, because over the ages of 40 or so is a kind of comparable older age range as for the general population. So older adults we know are particularly vulnerable, likely due to compounding medical risk factors and physical exposure to heat, but we're seeing a similar pattern across heat events. So then we looked at wildfire smoke events and looking at smoke exposure on its own. So this is PM 2.5 from a wildfire. We found that cardiorespiratory ED visits increased for housed people with an odds ratio of 1.18, so 18% higher than on a non-smoke day, but not significantly for unhoused people. Their odds ratio was 0.91. And we had a few hypotheses here. One of them is that many unhoused folks are in urban centers, like Catherine mentioned. And while wildfire smoke concentrations, they actually might be lower in those areas than in rural areas. And another is that smoke is a more variable exposure. So it can really differ dramatically between where someone is located and living and where they're taken for care, unlike heat. And like Catherine mentioned, the way that we assigned exposure in this study is we assigned it as the zip code of the hospital that the person was brought to, which we know that could be very different in terms of the smoke exposure, but likely is similar if it's in that general zip code or area of the person who was brought to the ED and where they've been sheltering.
Hey, Scarlett, I just want to jump in with a time check so we have enough time for Q&A.
Thanks.
Yeah.
I got 2 more slides. Thanks, Isabella. The last one is this combination of hot and smoky events, or combo days. And on days when heat and smoke occurred together, they were relatively rare. We saw an elevated heat-related illness risk for both groups, unhoused and housed. But for cardiorespiratory illness, only housed folks had a significant increase. Our interpretation here was that heat is still the dominant driver of health risk, probably. Smoke may be contributing, but heat illness is likely driving the effect. And again, these combined events are rare, which suggests that this could be a great case for doing a targeted smaller scale study, for example, zooming in on a single extreme event to better understand what dynamics are at play. And so my last slide is just kind of wrapping up and summing up everything from this analysis that Catherine and I have been working on. This helped us test new methods for identifying health impacts of heat and smoke on a population that's often missing in the data. Using this zip code of ZZZZZ, which is coded for an unhoused person since 2019 as they leave the hospital, is a way to give geographic representation to unhoused patients. And actually, as of 2023, hospitals will also be required to provide the best zip code for a person who is unhoused, which eventually will allow us to look at even more precise exposure estimates. So we will be definitely continuing on with this work. We were able to do this at the state level, which hasn't been done yet, to our knowledge, and we now have a much better understanding of how heat and, to a lesser extent, smoke affects ED visits for the unhoused. And of course, there are limitations here. We only had 2 years of data. This doesn't include outcomes like mental health, which we're really interested in looking into as well. And ED utilization really changed during the pandemic. But we're working on expanding this work, which we're planning on expanding to look at additional health outcomes, more years of data, and then potential zoomed in analyses of specific fires or heat waves. And on that note, I'll pass it to Joe.
Yeah, so this is just to follow up on everything that you've heard today, particularly in these research analyses, is that we will be transforming these PowerPoint presentations into some data briefs that will be available on our website by the end of the summer. So 2 briefs coming out of the work that I was presenting on behalf of our previous member of Tracking California, Katie Hyde, that will give you a bit more information about how we updated our nationally consistent data measures using that housing status update. And then a brief on containing the data from what I present on heat-related illness from the unhoused, and then finally a data brief from Scarlett and Catherine on their Heat Up project. So yes, it will be available at the end of the summer. And additionally, we just wanted to say thank you to all of our collaborators and for UCLA for getting us involved in their project and how it helped frame our investigations and our research analyses that you've seen presented today. So I will hand back over to Isabella.
Thanks, everyone. So now we'll get started with the Q&A. There's some in the chat, so I'll start going through those, and then feel free to add more questions, or you can raise your hand if you have something you want to ask. So the first question that was in the chat is, are there other ways to measure heat-related illness other than ED visits? So I don't know, whoever wants to take it, feel free to unmute.
Yeah, so I jumped in on this a little bit while I was talking. Yes, and definitely a subject of discussion at Tracking California, because we already present nationally consistent data measures, and so we have access to and work with hospital utilization data. That was the natural kind of first step to start looking at this. But some recent conversations that are coming in with our new director, which is really exciting. There's a lot of kind of energizing movement on the heat and health place within tracking right now, is looking at ambulance records and sorry, I'm forgetting the name of the data set. Joe, you might know it, or Catherine, but looking at emergency response to acute event data sets. There's another name for that, but there's a whole network of those kind of rapid health data that might be tracking extreme heat a little bit better than the ED visits that we're looking into. And then there's, the level of like specific clinics. So some folks will look at this within a healthcare system, like the San Diego study. So be looking at, you could look at all of Kaiser data, for example. But again, like I said about ED, it kind of catches everyone who goes to an emergency department for, an acute health event.
Thanks, Scarlett. Also, can you unshare your screen, please? Thanks. And then there's another question that I know is answered, but I had kind of a further question for our data team. So the question was the older adults age range, which was 35 to 64, is pretty wide. And they were just wondering if you could stratify further. Is that like a request that outside folks could send in to our data team if they want support looking at those data sets or that sort of thing?
Yes, but I mean, it would all depend on the specifics. This is Jackie with tracking. We are able to look at it by, customize age groups or years or counties, but as long as we have the cell size counts to be able to share, then we could do that for folks if they reach out.
Thanks, Jackie. And then someone had a question for the UCLA folks. What are your plans for updating? And I know, Rachel, you answered that, but I don't know if you want to elaborate or add anything else to that response.
Sure, I can start and then Rachel, do you want to hop in? It's a really good question. And, we hope to, first of all, get feedback that as we are able to, we want to, in future versions of the tool, we hope to be able to incorporate as much as we can. This project, as we mentioned, was funded by NASA's Equity and Environmental Justice Program. And the goal of this project, they were pretty rapid 2-year projects that involved using publicly available NASA supported data sets. So we're using, publicly available remote sensing data and reanalysis products for the meteorological data, as well as atmospheric modeling data in order to build out the tool. And so while our project is coming to an end, as Rachel mentioned in the chat, we are looking for additional resources so that we can expand beyond 2018, incorporate more years and more data sets as well. I don't know, Rachel, if there's anything else you want to add.
No, that was great. I would just say we are really excited to continue with this work. So hoping to do that.
Thank you both. And this question was also answered, but I just want to read it out loud in case anyone missed it. Someone was asking if basically you could type in an address into the tool and see the area that you're searching for. And the answer is yes, you can enter an address or just click on the map for whatever geographical location you're looking for. And then a new question came in, and it says, do you all have any information about how this data is being used? Is it influencing policy, gathering more funds? I don't know who wants to take that first.
I will speak to
Joe,
the
yeah, do you
tracking
want to?
work.
Yeah.
Yeah, just to the data, like we are just in the process of publishing these data, the findings and the results, as you've seen from myself and from Scarlett, and obviously the work on behalf of our colleague. So hopefully when we get these data briefs published by the end of the summer, it's something that we can use for outreach to do some influencing. But yeah, that space is we haven't quite got there yet with it.
Yeah, and just to build on that a little bit with the hot and smoky tool that we presented, we're in a similar phase right now. As we mentioned, it's this pre-release version that we have of the tool. We are also working this summer on finalizing the story maps, which we previewed in the presentation, and we're going to work on a scientific journal article publication as well that will be will supplement what we're having on the tool, which Rachel shared the link to in the chat if you're interested.
I'll just jump in lastly of some kind of smaller but really influential, in my opinion, ways. So some of the work that we've shared in the last webinar is up based in Lake County. It's called the Charm Project. We've partnered with Big Valley Band of Pomo Indians. Hi, Sarah, I see you on here. And just a very small kind of connection to this. Cooling centers, I just see your comment, Lizzie, exactly. But is, for example, understanding the burden of heat-related illness in Lake County, which we were able to use mostly from the Data Explorer. So before even these analyses were conducted, producing tables and figures and sharing them with our working group and our partners up in Lake County, they were able to then use those data to apply for research, grant funding. So they're now using certain tribes or using those grant funds to do weatherization efforts with communities on their rancheria, including air conditioning and heat installation. So there's little ways like that that are filtering into communities, but cooling centers and informing that development, we have several projects that are related to that right now. And I think I would say that's another larger intervention solution that we're working in that area too.
And then one question was for someone who couldn't make it today, but they were wondering, how are public health departments expected to operationalize this data to reduce health-related illness and death? So I don't know if anyone on our team or the UCLA team wants to take a pass at this, but I know there's also some folks on from CDPH, so I don't know if anyone else wants to respond to that also.
This is Jackie again from Tracking. I mean, there was a lot of tools and data that we talked about today, so I'm not sure which ones specifically, but even just thinking about the focus on the unhoused and just knowing that there could be expanded outreach to those communities during these heat events or wildfire events, as well as identifying where kind of they're most impacted even by area. So whether it's more outreach, more cooling centers, or just helping prepare them a little bit better, I think is one easy kind of way, but I'll let others speak to the other projects and data tools that they presented on.
Yeah, I can hop in briefly. I thank you, Jackie. I think that's something that comes to mind for me as well. From thinking about the combined event, so where we're looking at heat and smoke together, I would say that something that we hope our work can help to inform is when we're thinking about different adaptation measures that might improve health outcomes, sometimes they could be at odds with each other if you're looking at individual categories of climate events. So you could think, I mean, this is thinking about the general population, not the unhoused population specifically, but if the guidance during a heat event is to open your windows, get outside, find shade, but during a wildfire smoke event, it's close your windows, run an air purifier, or if you have access to one, and seal everything up. Well, if it's hot and smoky, then what are you supposed to do? And so what we're trying to look at is through these data resources, where are we seeing this overlap? How is that changing across the state and changing through time?
Thanks all. And then there's another question that has come in. And this person is wondering, in addition to syndromic and pre-hospital surveillance data, they're curious if anyone has looked into using crowdsourced data sources.
I'm gonna ask if anyone from OHE is on the line that might have something to add here, because I know they've been looking at some of the more syndromic surveillance data sets. I don't know if they're still on. Doesn't look like it, but we haven't. Not yet, but I know some of the EMS data is definitely of interest, but we haven't gotten there yet.
Thanks, Jackie. And then we'll just have time for this last question. I think I'll pass it to UCLA, but they're just curious about what methodological approach was used to estimate the tract level for PM 2.5. for wildfire and PM 2.5?
Well, so thank you for the question, Andrew. We agree that it's a limitation of the CMAQ data, which is the spatial resolution. But a benefit is that it is a comprehensive air quality model that allows us to separate out wildfire and other fire emissions, the contributions to surface level PM 2.5 from other sources. And so we actually have some parallel work in progress where we're looking at comparing modeling derived estimates of that smoke specific fraction from other statistical and machine learning estimates that rely more on what we can get from ground monitors and using statistical approaches to separate out that fraction. Rachel, I'm not sure if there's anything else that you'd want to add.
No, that covers it. And then in terms of the platform, we ran the analysis combining the heat and smoke data on Google Earth Engine, but the dashboard was developed using an ArcGIS Esri dashboard.
Thank you both. And I know I said that was the last question, but one just came in. Let me read it. So Lurk, the beta tool showed compound events were around 1% of the days over your 11-year sample. Would this suggest that compound events do not require as much of a public health response as heat waves or smoky days, especially if the impact on HRIs is not statistically different among these events?
So I can start with the UCLA side, and then I don't know if anyone wants to hop in with the additional studies. So yes, what we did find in some of this, what we showcased the kind of the baseline level of our analysis, which was looking at different definitions for what constitutes an extreme smoke event and an extreme heat event. We've also explored various sensitivity levels as well. And so while it is a small portion overall based on that base case definition, it is growing and it can be really locally significant as well. So I think that's one point. And then the other as well is when for some of our parallel work with other collaborators where we are seeing that there are synergistic health effects. So the health effects for heat and smoke combined are aggravated compared to either individually, and it's not an additive effect in many cases. And so with that, it would actually suggest that some of the interventions we might want to consider could be triggered at lower thresholds, because a lower threshold of heat, when that's combined with a smoke event, might result in additional adverse health outcomes.
Yeah, and I think thanks, Miriam. I think that's a great explanation. And just adding on to the kind of work that we were looking into, we did see increased risk for these events among the general population, but we didn't see it, among unhoused folks. And I think, again, that comes back to these are very localized events. We were looking at a statewide level. And I think, moving forward, we'll probably look at more, concentrated events, maybe in specific areas, to see if we can, kind of fine tune to see if we're seeing these at a more localized level. Because at the state level, we were only looking at 2 years of data, which is very kind of preliminary looking at it. So I think down the line, we'll look at more years of data and again, do kind of, specific geographies where these, combined heat and smoke days are happening.
Thanks, Catherine. Let's move on. There's a question that just came in the chat, so if someone wants to respond to that, please do. But we do have one last poll that we wanted to pull up just to hear everyone's thoughts on how the webinar went today, as we only have 2 minutes left. But I just wanted to say thank you, everyone, so much for joining. Thank you so much to all of our presenters and collaborators for taking the time today to share your tools and resources. I'll post links in the chat to our website and then contact information And like I said at the beginning, we'll share the recording and any slides that are available to share with everyone after the webinar. And thanks, Scarlett, for sharing your contact information.
Thanks all for joining. Take care.